Hey there, everybody. This is Julie Lundberg from Triarq Health. I've got Brent Harrod with me again today, and as you can see from our title, we're going to talk about the next sort of phase of our MIPS conversation, right? We've been talking about MIPS for several months now, and we've done a lot of deep diving into what MIPS is all about, and today we really wanted to focus on why we're encouraging you to maximize your MIPS composite score. So I'm going to try to make this a lively and interesting conversation. It can be a little dry. There's a lot of detail here, and I'm going to try and take you along with me and reference some of the really great tools that CMS has made available to us. So with that, we always have this fun little thing where it doesn't want to advance to the next slide. Once we start the webinar, okay, now Brent, I think we're successful. Okay, here we go. So here's our agenda. We're gonna, as we always do a really lightning quick fast of the MACRA QPP MIPS basics. We're gonna introduce, we've talked before about physician compare, but we're gonna do a deeper dive into the physician compare initiative. And most significantly, the physician compare preview period. We're gonna talk a lot about that. Again, because we're in medicine, we love our alphabet soup. We're going to talk about the EIDM, which is your Enterprise Identity Management, how you get your logon. So you can access your PQIP and your QRUR. And then we're going to talk a little bit, we'll conclude with a little bit of shades of things to come, you know, the notice of proposed rulemaking for next year's reporting period. Okay. So this is the slide. You guys are getting sick of looking at this one, but I think it's always good to reiterate for those who haven't spent time with us in the past. So MACRA is the Medicare Access and CHIP Reauthorization Act of 2015. Recall, this is the law that had strong support, both sides of the aisle, both houses. This one's not going away. The QPP, Quality Payment Program, was a huge part of MACRA. QPP really, how do you participate? There's two routes, really. You can be in an advanced APM standing for Alternative Payment Model, and those routes involve the Oncology Care Model, CPC Plus, the MSSP tracks 2 and 3, 1 Plus will come into play next year, as well as the new generation ACO. And then the other track where most of our folks live is the MIPS track, so the Merit-Based Incentive Payment System. And again, remembering that there were really 4 original performance categories: quality, ACI, CPIA, and cost. Cost does not count in this reporting year, and hopefully not even next year. So we leave it in there as sort of a, you know, don't forget about cost. We're going to actually dive into that aspect a little bit today. And then if you are in a Track 1 MSSP ACO, you kind of live in both worlds, really. Your focus becomes very much on the ACI portion as an individual provider. Your ACO will handle those other categories for you. Okay, so very, very fast review of what MACRA QPP MIPS are all about. We do like to take this slide to help us review MIPS again. So we just mentioned the 4 performance categories. It helps us to remember, right, that quality is inherited from PQRS. It's not foreign to us. The improvement activities category is a new category, but it does count for 15% of your MIPS composite score. The ACI category, advancing care information, again, very familiar to us because it inherits from the meaningful use program. And then cost is really the replacement of the value-based modifier. And I'm going to talk a little bit about the value-based modifier and your QRUR reports today. And as we said earlier, you know, cost does not count this year and may not even count next year. But we want to keep it on the radar so that we understand how it's ultimately going to impact us. All right, that was a really fast breakdown of MIPS, the MIPS track of the QPP. In addition to the financial impact, we always like to focus on, you know, it's not just about your money, it's about your reputation, right? So the Physician Compare website is where you can go, your patients can go, and they can ultimately view your composite score, your MIPS Composite Score. And this is truly the focus of today's conversation, why we think it's so important to maximize your MIPS Composite Score. It's not just about your money. So to that end, today, the bulk of our conversation is going to be about the Physician Compare Initiative. All right, so what is the Physician Compare Initiative all about? The Centers for Medicare and Medicaid Services, CMS, provides this site to give physicians and other clinicians the latest resources and information about Physician Compare, the website designed to help consumers make informed choices about the health care they receive through Medicare. Well, my good pals in Connecticut agreed to allow us to show their feedback on Physician Compare. So the way this works is you go search for your provider or a provider in a community, and the feedback report will display for you. So Dr. Mara, an excellent podiatrist in Enfield, Connecticut, this is his report as it looks today. We know that Dr. Mara is part of an ACO, so his participation is, and there's a little note here that says he reported his performance information as part of an ACO. So this is what you can currently see out on Physician Compare. This changes dramatically in a very short period of time. So we want to talk about how to give you all a little bit of insight into what's going to be showing on the Physician Compare site. So there's a lot of discussion out on CMS. They did a nice webinar recently on what they're calling the Physician Compare preview period. So more data is coming to Physician Compare very soon. As luck would have it, tomorrow is the date on which the preview period begins. So from October 18th to November 17th, we will be able to preview the data that is going to be shown on Physician Compare. We want to keep in mind that the data that they're going to be showing is all about the 2016 individual clinician and group performance information before it's publicly reported on Physician Compare. So we want to take this next month to make sure that we can get into into the preview, so we know what kind of information is going to be on Physician Compare for our groups and our clinicians. Like I said, CMS did a really thorough job, and I'm going to walk you through these next several slides are all about the tools that they have published to help you take advantage of this preview period, so you get a real feel for what's going to be displayed about you or your practice or your group. So to become an expert at navigating the preview period, you want to go check out their toolkit. The preview period toolkit is comprised of 5 tips to the preview period. I'm going to review that as well. The Physician Compare Guide to Preview, and then lastly, the 2017 National Provider Call presentation slides called Physician Compare What You Need to Know. So the screenshot I'm showing you here is it's on the Medicare website, and it's a deeper dive into what I am going to try and review and get you oriented to. But I highly encourage you all to visit this website, take advantage of the documentation and the tools that they're providing to help you understand what this is going to be all about. Okay, so the next slide, I apologize, there's a lot going on here. This is a breakdown of what they call the 5 tips to the preview period. So they have downloadable resources, right? We just talked about that very briefly. The Physician Compare Guide to Preview. I'm gonna do a little preview of that. And then there's also the National Provider Call presentation slides. There was a lot of great content there, and I'll touch on that briefly. There's a lookup tool. You could use the lookup tool to see if you have measures that are available for preview. Keep in mind, this lookup tool isn't available until tomorrow, so don't try to do this today. And then you want to learn more about using the tool in, again, the Physician Compare Guide to Preview. So we're going to keep reiterating these words that are going to stick in your head. Probably the single most important thing you should take away from this webinar today is to establish your EIDM account and user role. We've been talking about the EIDM for a couple of years now. This is where you've traditionally gone to receive your QRUR. This is where you will now also access your PQIP, Provider Quality Information Portal, the PQIP. I think they call it the PQIP or PQIP. This helps you. Again, it's painful. I'm going to talk about it a little bit. It's not an easy thing to establish your EIDM account and user role, so don't delay. You want to jump on that as soon as possible. Preview your data early. So they're saying to you, we're giving you this 1 month period for you to get in there and see what it looks like. And if you think there's a problem, you have an opportunity to get back to the folks at Physician Compare and help them see what you believe to be an issue. And then also, it's always a good idea to sign up for the reminders and updates. So if there's a change or any late breaking news, you want to be, you don't want to have to always be digging for it. If you sign up for the e-news, right, it just shows up in your inbox if there's something new that you need to learn about. So you definitely want to visit the Physician Compare Initiatives page, and you can always email them at physiciancompare@westat.com. I did that this weekend. I had some clarification that I was seeking. I have not heard back yet, but I anticipate they're getting a lot of queries right now, and I hope to hear back from them, shortly. So I want to talk a little bit about this lookup tool we just mentioned, right? This is what's not available until tomorrow. If you reported PQRS in 2016, there will be data for you to review, so you can get into this Physicians Compare lookup tool. And I think this is it's going to be handy dandy to help us understand, do we need to be engaged in this exercise? And I'm going to say for most of you, I hope so. I hope you reported PQRS in 2016. That's just one source of the data. Okay, so we talked about this EIDM account. There is a 36-page guide on how to go about creating your enterprise portal account. I highly encourage all of you to do this. Once you've created your account, you also have to make sure you've got the proper user roles, and certain people can access reports for providers, others can access reports for groups. So I can't cover all 36 pages in our time together today, but I would highly recommend that you get yourself over to the QualityNet portal and get logged in and start creating your account. And if you have questions, take advantage of their help desk. There's a phone number here, as well as the QNet support at hcqis.org. So the message here is get that EIDM account created so that you can get to all this great information that we're going to introduce you to today. This is a nice document. It's 11 pages long. I think they did a good job pulling this together. So they call this the Guide to the Physician Compare Preview Period. So I'm going to reiterate this. This is what we're focused on today, is helping you understand how you take advantage of the Physician Compare Preview Period, so that you get a feel for, what kind of data they're going to be publishing about you. This guide describes how to use the PQIP, right, the portal. The PQIP is a portal that allows clinicians and group representatives to preview their 2016 performance information before it is published on Physician Compare later this year in 2017. Who should use this guide? Clinicians who submitted 2016 PQRS and or non-PQRS QCDR measures data, and if you individuals representing groups that submitted 2016 PQRS measure data and or non, so it's groups and it's individuals. Okay, why? Why do we want to preview this? Again, a chance for you to see what your patients are going to see before the performance information is published to Physician Compare. You'll also be able to see which of the measure data you submitted for 2016 that's targeted for public reporting. Not everything is targeted for public reporting, and we're going to dive into the concept of the the Physician Compare profile page versus the downloadable database. So we'll try to break that down for you a little bit. Not everything is real, like in your face when you go to these sites. Some of it you have to actually download, and then dig into the downloadable. And most importantly, the reason we're really driving this home, and that's why I've got it in big, orange, bold letters, this is offering us a sneak peek into what our MIPS data is ultimately going to look like. So there will come the time when our MIPS data is going to show on Physician Compare. All right. So what is the PQIP, Provider Quality Information Portal? What's it going to look like? This is a screenshot from one of the documents that they've provided on this topic. So I took a little screenshot of, this is a group. So this is data that's being reported on a group. And they break it down into 3 possible tabs, depending on what was reported for the group. So the very first one's called your performance scores. Again, this appears only if you or your group have performance information from the 2016 reporting year. So if you reported PQRS last year, you'll have data here. The patient survey scores tab. So if any of your patients completed the CAPS survey, that feedback will be here. And then the downloadable data tab. This data tab appears only if you or your group will have performance information in the downloadable data sets when they become available. And that was one of my questions out to the Physician Compare folks is, is there a way for us to have a preview of what's going to be pulled out into the performance scores tab, so right here on your profile page, as opposed to what is going to be included in the downloadable. So I'm going to try, I think I have a little bit to share on that, but I'm still seeking some clarification from these folks. Okay, so when we're talking about the performance scores, there's 2 concepts here. There's percent performance, and then there's the star rating. You're going to start hearing a lot more about this concept of the star rating. Performance, so we'll talk about the first screenshot here that's over on the left. The performance scores represented by the percentage are all the publicly reportable measures for individuals and some measures for groups. The performance scores represented by the star rating are 15 specific measures for groups only. So if you report it as an individual, you will not have any star ratings on your profile page this year. I think this is a little bit of an esoteric difference here, but just trying to help folks understand the star rating concept because it's going to continue to expand. What we're going to see as a limited amount of data represented by star rating this year, it will continue to grow. Okay, so I want to go back to this page here where I put in quotes, publicly reportable. So, as with all things that are produced by our government, I think you have to really read the fine print. So I wanted to know more about that qualifying statement. What is publicly reportable? They reference the actual PQRS implementation guide, and that's what I've got a little screenshot here of that guide, and then this is excerpted straight out of this page 9 of the 2016 PQRS implementation guide, and it says to us that per the 2016 final rule, all PQRS quality measure data collected from individual EPs and PQRS group practices via all reporting mechanisms are available for public reporting. So basically everything. In addition, all individual and group level QCDR measures and CAPS for PQRS summary survey measures are available for public reporting. And they even, you can find this little statement in there that they even put it right there in black and white. All data that met the public reporting standards will be published on Physician Compare in late 2017. Okay, so for more information on public reporting, view the CMS Physician Compare Initiative website. So bottom line, if you reported PQRS, it's considered available for public reporting. Okay, now here's another little qualifying statement. So back here it said that meet the public reporting standards. Okay, so available for public reporting, and now we've got some fine print that talks about what does it mean to meet the public reporting standards. I stole this nice infographic from the AANA, so it's a little, hope that's good enough little bibliography there to give them some credit for. I really liked the way they presented this information. So there's a lot of statistics, statistical significant tools that are used to make sure that the data is meeting public reporting standards. So we'll read this little blurb here. Any information publicly reported on Physician Compare must be designated as available for public reporting in the calendar year. Measures publicly reported in the downloadable database must have a sufficient number of reporters, so enough physicians needed to report these, and they must meet our statistical reporting criteria. This means measures must be deemed statistically valid, reliable, accurate, and comparable. Performance scores for all measures that meet these statistical criteria are available for inclusion in the downloadable database to support CMS's goal of increased transparency. So that is all excerpted from the document we referenced earlier called A Guide to the Physician Compare Preview Period. So if you look at the infographic, right, we know that at least 20 patients, someone had to report that on at least 20 patients for that particular measure. And then all the statistical analysis that it goes through and blah, blah, blah. So they're trying to be very responsible about the data that they're publishing on us to make sure that it is representative of actual quality. Okay, so I want to break down, what we can expect in the downloadable as opposed to the profile page. So again, this is excerpted straight out of the, there was a webinar that they did in April called Physician Compare Benchmark and 5-Star Rating. We're going to talk a little bit more about that. So I think they did a really nice job, and I tried to enhance this with some arrows and orange boxes to try and help us understand what's going to be in the downloadable for groups and clinicians and what will be in the Physician Compare profile pages for groups and clinicians. So again, we're going to reiterate this. All measures reported on profile pages must meet statistical public reporting requirements and resonate with users. In orange bold, we have, as part of our phased approach to public reporting, a subset of 2016 group PQRS measures will be reported on profile pages as star ratings. We talked about that earlier, right? If you didn't report as a group, no star ratings on your page. And I think the takeaway here is there's fewer measures are potentially reportable on your profile page as compared to the downloadable. Okay, so I think I have, okay, good. So for this year, these are the measures, and I think there's 16 of them. I counted them earlier this week. Group measures reported as star ratings. So if you reported as a group and these were any of the measures you reported, it's going to be represented as a star rating on your profile page. The little sentence here at the bottom is letting us know this is going to expand each year, so we're going to have to get more and more used to this whole concept of star ratings. In the webinar that they did about a month ago, the Physician Compare folks spoke about the star ratings and raised an interesting point that I felt was important to repeat here, and that is that the star ratings are reported only at the level they were collected. So if you report as a group, the star rating is going to be available only on the group page. So the individuals who report with the group won't have the star rating on their individual profile page. It will just be on the group page that they're associated with. So I thought that was kind of an interesting distinction. I think it's also important to reflect on the mechanism that's being demonstrated for us here, right? These are the PQRS measures if you reported as a group, and let's not confuse that with a group measure, right? So how many more confusing words can we throw into this topic, right? Most of our folks reported on a PQRS measures group. That was, I could pick 20 patients, I could pick a specific measures group, preventative care, or, you know, total knee replacement, or, you know, there were certain groups that were, you know, 5 or 6 or 8 different measures, and I could do it on just a subset of my patients, and I had to do that via registry. That was a measures group. Group reporting is different from that. And these are the different mechanisms available for group reporting, and you'll notice that, you know, if we reported getting a flu shot during flu season, they're saying if you reported via web interface, it's going to be available as a star rating, but not if you reported it as via registry. So really narrowing what is going to be available via star ratings. Okay. So I've referenced this a couple times, the National Provider Call presentation that was presented in September, Physician Compare, What You Need to Know. The link to that webinar is out on the CMS website. I have a little Reader's Digest icon there to help you see. I'm trying to 3x5 this for you. The bulk of this presentation was devoted to the Physician Compare benchmark and star rating. So there's a lot of documentation, and I think if you're a statistician, you'd really get into this. But they go to great lengths to help you understand the achievable benchmark of care, which they refer to as ABC, as well as the equal ranges method. So if I'm going to have a 5-star potential, you know, how do I get, you know, how do they divvy up, you know, who's in the 1-star, who's in 2, 3, 4, and 5. So they spend a tremendous amount of time helping folks understand how they came up with this. You know, you might want to fast forward through that part unless you're really passionate about it. But I appreciated some of the details they presented regarding the PQIP and the preview period. Okay, so that would be the last if you have limited time, this would be the last resource that I would leverage. Okay, so we've talked all about why we want you getting onto, why we want you to get your EIDM, why we want you to go into the preview period. The other thing you can do with your EIDM, which everyone should do, is understand your value-based payment modifier, as well as your quality resource and use report. So we're going to talk about this. I want to help folks understand the value-based payment modifier, right? The last reporting year was 2016, so the last year you'll see this impact your Medicare payments will be in 2018. So to talk about the value modifier, we really kind of go back to you know, value-based care and what this is all about, right? And this is a lot of what we do here at Triarq is you know, aligning and redesigning around quality. What is value? Value is really quality plus cost. So the value-based payment modifier that impacts your reimbursement from Medicare. This is right out of their documentation about how the value modifier is calculated. For the quality portion, they look at 2 different things. They're looking at your PQRS, right? We've just talked a whole lot about your PQRS measures. So they take your PQ, you had to report for PQRS or you were getting a big negative adjustment for the value-based payment modifier. So you had to at least report. So they took your PQRS reporting, and then in addition to that, the quality measure component of the value modifier also includes up to 3 outcome measures that CMS calculates for Medicare fee-for-service claims. 2 composite measures of hospital admissions for ambulatory care sensitive conditions, so they're talking about acute and chronic, and then 1 measure of 30-day all-cause hospital readmissions. The cost component of the value modifier, they roll 6 different cost measures into that, and they list those for us here. So total per capita cost for all attributed beneficiaries, total per capita cost for beneficiaries with specific conditions, diabetes, coronary artery disease, chronic obstructive pulmonary disease, and heart failure, and then the Medicare spending per beneficiary measure. So this is really what the value-based payment modifier has been about. We have some old webinars out there about this. The upshot is it's helpful for you to understand it, as it will impact your 2018 payments from Medicare. The value to really understanding more about it will help you when they start counting cost as part of your MIPS Composite Score. And there will be more on that in years to come. But I just wanted you to understand a little bit about why do you care about your QRUR, and it's so that you can get to those are the feedback reports that help you understand your value modifier. So now I'm breaking that slide we just talked about. I'm adding some pictures to it. So the first image here is straight out of one of my clients' PQRS payment adjustment measure performance detail report. When you log in with your EIDM, you get in and you can get this feedback report. So we know that they reported via a measures group. So this is giving the feedback on that, the reporting of that PQRS of 2016. And then the screenshot in the lower right is really the QRUR quality performance measures. This is a screenshot that I snagged out of one of their documents on how to obtain your QRUR. So it's kind of fuzzy and a little bit hard to see, but these are the two quality components of your value modifier. And then, as we discussed 2 slides ago, the cost component is, and I just repeated for you here, the things that roll up into the cost component, and this is a little screenshot again from their document on what that looks like. Okay, so I highly recommend you follow their documentation once you created your EIDM account. Make sure your user roles are set up properly, and then you follow their documentation to go obtain the QRUR. If there is any way you could make this happen before tomorrow, that would be a good thing for you, because yay, there's a webinar. CMS is doing a webinar tomorrow all about how to interpret the QRUR. They put right here in their little blurb about promoting this webinar that if you've got your QRUR in front of you, it's going to mean more to you when you attend this webinar. Even if you're not able to get your EIDM and get your QRUR, I still think it's a good idea to attend, just so you understand more about how folks are viewing this data and how it may ultimately be displayed on your physician compare profile. Okay, this is a kind of a cool little feature. The big takeaway here is you don't need an EIDM account to do this. So this is the payment adjustment and feedback report lookup features. So this is a new feature on the CMS Enterprise portal. It allows you, and I just did this, I don't have an EIDM account. I went in and I sort of disguised the numbers I typed in, but I did this for one of my customers, typed in the TIN and the NPI, hit lookup, and it is telling me that there is, so in the very bottom here, this feedback is, the TIN NPI did not receive a 2018 PQRS payment adjustment, which is good, right? There were only negative adjustments to be had. So that means we did what we needed to do. And so that's what you can see here. So I entered the TIN and the NPI in the lookup tool. I learned that we've successfully reported, and I also learned our feedback reports are available for review. So that's what this is telling us down here. We can look up and say, oh yes, so the feedback that came back from entering in the TIN or the NPI was, a report is available, and it lists all the years of PQRS and the e-prescribing incentive program that are available for me to review there. So at the bottom, I've given you the link to this, which no one can retype that, so I don't know if we published the actual slides with a functioning link, but that is where you would go to see, hey, do I even have something to look at So might be a good idea to go take advantage of these tools since you don't need your EIDM account. Okay, I want to talk a little bit, I know that was a lot of data, you guys. I want to talk a little bit about the proposed rule. We reviewed this last time. We're kind of all waiting around for this to be finalized. I think that's going to happen in the month of November, right? The rule was published in June. There was a feedback period that ended in August, and we expect the rule to be finalized in November. So what's the rule all about? So the low volume threshold, right? They're really raising the bar from 30,000 to 90,000. So if you receive less than 90,000 in total allowed Part B charges, you would not have to participate, or if you have less than 200 patients, you would not participate. The virtual groups concept, I think, is one that really intrigues us. As we reviewed in our last webinar, lots of advantages to reporting as a group, but if you're not part of a group, you can become part of a virtual group next year. I think that was a very intriguing concept. CMS did a nice webinar on that early, I want to say it was like last February. And they're really reaching out to the community to say, hey, tell us how you think this should work. There were some interesting restrictions around the date at which you could engage as a virtual group. You had to declare by a certain time, but oh, well, wait a minute. I don't know if this guy has good scores because the previous year's scores aren't available. You're making it hard for me to make a decision who I should band together with. So interesting, concept, and I think they're still working out the details. The submission method, this is going to be really nice, right? They're going to permit the use of multiple submission mechanisms even within a single category. So the greatest example I can think of here is the quality category, right? We could do some via my EHR if my EMR has a quality dashboard that has measures that are meaningful to me. I can submit through my EMR. Or if there aren't enough measures that way, I can also submit, through a registry. The exclusion of the cost category for 2018, we talked about that earlier. We really all expected that we would have to report costs in 2018, and that it would be 10% of our MIPS Composite Score, and they are talking about excluding it again for the 2018 performance year. Additional HIE exclusions, we will all really appreciate this one. So if you refer or transfer out fewer than 100 patients in the reporting period, you will not need to meet the HIE measure, right? So they're kind of got to bring back that exclusion they gave us in meaningful use. Right now, we're all running around making sure that at least one person in our group, if we report as a group, or every individual gets that one, summary of care sent upon transition of care in order to meet the base score for the ACI portion. So we'll appreciate that if they grant us that exclusion again. The 2014 edition cert is acceptable. Originally, you were going to have to be on your 2015 edition cert, so that's going to be nice for folks. Those who are on 2015 edition cert are going to get a bonus, which will be very nice in the ACI category. There's also going to be a small practice bonus. So if you work in practices with less than 16 providers, you're automatically going to get 5 additional points added to the MIPS score. In addition, there is what they're calling the HCC bonus, hierarchical care condition, I think is what that stands for. So providers who have complex Medicare patient populations with a HCC risk score greater than 1 could receive between 1 and 3 bonus points on their MIPS score. And this is very intriguing as well, the quality improvement bonus. So, right, we've been submitting quality data and we'll submit as part of MIPS. Guess what? If you continue to improve your quality score, you're going to get bonus points for doing that. So you're going to kind of set your own baseline. And if you perform higher than the baseline you reported in the previous year, you could earn some additional bonus points. So I'd like to give you the resources, where are we getting all this data? We try to really verify. Our good friend Jim Tate, the EHR advocate, has made us aware, and I think we all feel his pain and agree with him. There's a lot of bad information out there, so I'd like you to know, where did I get the information? So here are the sources. Be careful There's a lot of misinformation out there. There's even, I mean, you can stumble into a webinar that CMS did regarding the MIPS proposed rule, and there are things in it that are simply not true, that weren't in the final rule. You have to really be careful of the content you're looking at. I'm always trying to find a date on the things that I read, and then you know, be careful who you listen to. CMS is really the horse's mouth. Okay, I'm going to hand it over to Brent to talk about the GlowStream, aka Triarq Health Services, to help you on your journey.
Thank you, Julie. So I hope what everyone's getting out of today's presentation is just how complex MACRA MIPS is in the investment that you're going to have to make from an expertise and from a time perspective. Want to let you know that we are here to help over here at Triarq Health. We have rallied behind our practices and see this transition to value-based care and the MACRA MIPS program as an opportunity for our independent practices to thrive. What we've done is simplified our solution sets or our offerings to two different offerings, Triarq Q Complete and Triarq Q Pro. Triarq Q Complete provides you all of our services, all of our tools, including a dedicated performance manager, including our billing services for a percentage of collections. Triarq Q Pro is very similar to Q Complete. Again, we offer all of our tools, so all of our technology and all of our services, but minus the billing aspect for a price per user. What we're trying to do is provide all of our practices everything they would need to be a successful independent practice to thrive today. And on the topic of what Julie's discussed, we will be helping our practices one-on-one to better understand and navigate and use the physician compare and tool and public reporting under both Q Pro and Q Complete. So you can see under this slide the services and materials and tools that we're providing our practices. Again, what you pay us today would go away and be replaced under either a percentage of collections or a price per user model. If you have any questions, please feel free to either reach out to your territory manager or our support team, and we'll be happy to answer any information or any questions that you have.
Thanks, Brent. So we want to also call your attention to Triarq Health's presence on social media, Facebook, Instagram, Twitter, LinkedIn, YouTube. There's a little screenshot there of our YouTube channel, right? That's where you can go see past performances of webinars like this one. You can follow us on Facebook. There's a picture of Brent and I playing a game. Brent, this was a lunchtime. We do a once-a-month lunch with our teams, and I think this was, are you smarter than a fifth grader? And I can't remember what our question was, but this is Brent and I facing off in Are You Smarter Than a Fifth Grader? A little event here at Triarq HQ. So follow us on social media, and there's lots of great stuff to learn about us there. So summary and next steps. So let's kind of land the plane here. We talked about a lot of things. Please create your EIDM accounts, and don't hesitate to leverage the tools and the help that the Quality Net Help Desk is offering. I encourage you to reach out to them if you get stuck. Please review the Physician Compare Initiative website. So we talked a lot about the content available out there today. Please go view and take advantage of the tools they've made available. Make plans to access your EIDM account between October 17th and November 18th during the Physician Compare 30-day preview period to review your PQIP, Provider Quality Information Portal. Download your QRUR feedback reports and attend that QRUR webinar so that you can learn more about what your QRUR is telling you. Here's some contact information, and we are thanking you for your time. Brent, I think that does it.
Thank you, Julie. Thank you, everybody. Looking forward to our next webinar next month. Take care.